I'm very excited to announce our next speaker. She's a registered dietitian with a doctorate in nutrition and has over 15 years of experience. Dr. Fergusson has a very unique background as a dietitian. She has worked internationally with organizations such as Unicef and the World Food Program. She has research, teaching, and public health experience, and has taught as a lecturer at the Liverpool School of Tropical Medicine in the UK. Passionate about sustainability, Dr. Fergusson is a member of the Dietitians of Canada leadership team on sustainable food systems. You may have heard her speak on the No Meat Athlete, Our Hen House, or Food Heals podcasts. Pamela is now working in private practice in Canada and enjoys an avid running career, having completed 5 half marathons, 1 marathon, 2 ultras, and 1 Ironman. Please welcome Dr. Pamela Fergusson to the stage.
Hello, and what a wonderful city. I'm just so happy to be in Portland. I drove down yesterday from British Columbia, had such a wonderful drive. I was fortunate enough to be accompanied by a friend of mine who is a plant-based pharmacist. Imagine a town of Nelson, British Columbia. We're only 10,000 people, but we have a vegan dietitian and a vegan pharmacist serving the community, and we're working on turning that community plant-based. So thank you so much for inviting me here today, and we are going to talk about behavior change. So I want to ask, how many of us here in the room, and this includes me, I'm going to be standing up here at the front, but how many of us here in the room work as a health professional one-on-one with clients? We sit down with clients. I want you to stand up if that's you. Wonderful, that's wonderful. Okay, thank you. So that's so many of us here in the room. That is absolutely wonderful. Now, the thing is, so many of us are working on behavior change. I'm going to guess from some of the results I saw earlier today when we asked who here is vegan, who here is vegetarian. I'm going to guess that many of us are working on helping our clients, our patients, transition to a plant-based diet. That's probably what a lot of us are working on, and that's a lot of what I do every day. But how much do we actually know about how to do that well? How successful is one-on-one counseling in terms of motivating behavior change? We do this, lots of us do this every day in our practice. And just like if we were prescribing a medication to our clients, or if we were, recommending surgery for a client or something, we would want to know about the effectiveness of that treatment. But we should also be asking ourselves about the effectiveness of counseling for behavior change and what we can do as practitioners to improve our counseling so that we can best assist our clients in making those behavior changes to improve their health. So today, we're going to talk about behavior change. Just what is behavior change? What are some of the strategies out there in behavior change? How successful are we in motivating behavior change? And how can we be even more successful? We'll do a little case study. So I'm going to give you a little bit of work here in this session. It's not only going to be me doing the work, you're going to do some work here with me today. And I know we have a lot of great brains here in the room, so we can work together. We'll talk about what's involved in a nutrition assessment. How many here are RDs? How many dietitians in the room? Excellent. And I'm sure many other health professionals here are also including nutrition as part of the health assessment that you are doing when you're working with a client. So we'll talk a bit about what we include in a nutrition assessment, what I include in a nutrition assessment, and get ideas as well from practitioners here. We'll talk about motivating change, and we will talk about motivating change on social media. Just a little bit of my experience from working in social media, what I've seen works for me, what I've observed works for others, and how you might, maybe you're thinking you would like to extend your practice into social media, or maybe you're already active on social media, and we'll talk a bit about what works well there. So what works for behavior change? It's interesting that actually this is a science that we don't really know all that much about yet. And there's so many variables that influence this in terms of what is going to work for each individual client. And that's where we as the practitioner come in and our role becomes so important. This is a paper from Nature, Human Behavior, and they were looking at what works for behavior change. And they were looking at some big studies, and they learned, interestingly, that targeting individual beliefs was largely unsuccessful in motivating behavior change. That just because you change someone's mind intellectually about something, it doesn't necessarily mean that that will lead to them changing the way that they behave. The way we behave is influenced by so many different things, not just what we believe, but also so many different influences. So we need to go beyond just speaking intellectually and saying, well, research shows that, you know, a plant-based diet is going to reduce your risk of heart disease by this much percent. The patient may believe you, the client may believe you, but knowledge and understanding don't necessarily always translate to differences in behavior. They also looked at descriptive norms. So this is kind of talking about what other people do. So this is a situation where they shared within the community. They're saying, you know, this is something that works for others. This is what your neighbors have done. Like, let's say for, you know, recycling. They were talking about motivating people to do more recycling. This is what your neighbors are doing in terms of recycling. And that worked well in some communities. Now, I'm Canadian, not American, so I won't pretend to know all that much necessarily about what works in America. I did live in Washington, D.C. for a few years, and I absolutely loved it there. But they were saying in this research that that worked better in the South, in the U.S. South. They were making the assumption there, or describing that people maybe had a stronger sense of community in the South. And in the North, people weren't necessarily as motivated by what their neighbors were doing. They may think, I don't care what my neighbor does. I don't want to be like my neighbor. I want to be like me. Whereas in the South, maybe, and this is a generalization, but we need to not just make assumptions that just, you know, what is going to work in one community or with one individual will always work for the others. Network interventions. They were finding that this could be helpful if the intervention fits. So this was looking at increasing activity in children. And with the boys, they were able to make kind of a gamification of earning points towards being more active. And this was, the boys were maybe a bit competitive and were wanting to score more points, and so this was kind of motivating. But with the girls, it was more motivating to have like an accountability partner, like another friend that they were doing the activity with, and sharing information between girls. So, you know, just to say that when you start looking at what works, we can very quickly start breaking it down and say, oh, different groups, different individuals, different people, different things will work for different situations. Now, what about dietary behavior change? Have any of you ever tried to change your diet? This is just a joke, but I think we all kind of know this story, right? Even if it's not you, maybe you've never tried to go on a diet and it failed. Maybe you have never. But the reality is that most Americans have at least some time in their life tried to go on a diet and then that diet failed, right? And so this is why we want to think about lifestyle changes and finding ways to support people for long-term dietary change rather than just thinking of a diet initially. So I have a question for you. That is to say, is counseling for weight loss actually potentially unethical? There's this idea out there that we might have seen on social media or maybe even in articles, this idea that 95% of diets fail. And I think we've probably seen that. People have probably seen that kind of message coming across. Actually, when you look at the scientific literature, there's not any real evidence of this, that 95% of diets fail. And we need to look at individual diets, and when I say diets here, I don't mean like crash diet. Now I'm talking diets like dietary patterns. We need to look at individual dietary patterns, different modalities of offering it as a therapy. But I think we do need to just take a step back and question. And this is something that's kind of happening right now in the zeitgeist. People are starting to question, does dieting actually work? Is this something that we should be doing? Even if 95% of diets don't fail, a lot of them do. You must know someone who's tried to lose weight and then either it didn't work or it did work temporarily and then they went off the diet and gained weight again. So as practitioners, I think we need to be sensitive here, and certainly not just sending a message of like, oh, you need to lose weight, and sending the person off on their way just thinking, okay, I'll go on a diet, and not knowing what to do. And I'm sure in the room here we are not doing that. But what can we do? How can we help? So I would certainly recommend that we encourage people to adopt a plant-based dietary pattern. And here I am talking about a whole food, plant-based dietary pattern, or at least predominantly so. So we're here in Portland, and I've got to say I'm very excited to be here, and I will let you know that I do plan on going out for vegan pizza tonight. So yes, so I am a dietitian who does eat pizza, but I don't eat pizza every day. This is a once in a while thing. It's like, oh, exciting to come to a city with lots of vegan restaurants. And we are so blessed now in a way in our society that we have so many vegan products. I mean, you know, anything that you can buy on the standard American diet, you can now pretty much buy a vegan counterpart to that. But vegan and whole food plant-based are not the same thing. So you can get vegan donuts, you can get vegan pizza, you can get vegan brownies, and there are recipes as well to follow online for all of these decadent treats. But when we're talking about prescribing a plant-based diet and lifestyle for our clients in terms of long-term health improvements, we're talking about vegetables and fruits. We're talking about beans and lentils, nuts and seeds, and whole grains. Okay? We're talking about those foods. And so it's useful just to start and to say that, just to set us all on the same page. I think we are on the same page, but just saying that that's where I'm coming from. And thankfully, we do have evidence to guide us that a whole food or predominantly whole food plant-based diet is successful in helping people achieve and maintain longer term weight loss and a BMI in the lower risk range. So, for example, in the Adventist Health Study, we saw that the only group of people who had a BMI below 25 were those who followed a vegan diet, a plant-based diet. We have research that shows that plant-based diets are a successful weight loss strategy. So the first study, the Adventist Health Study, was just looking at a population saying, how do people eat? Those people weren't necessarily trying to lose weight, but just saying those following a plant-based pattern had lower BMIs. Whereas people trying to lose weight, actually a plant-based diet isn't just about maintaining healthy BMIs for those who follow that, but it's also about weight loss, and it is a successful weight loss strategy when we follow that rule of predominantly eating plants rather than vegan treats. Characteristics of successful diets are reduction in energy and fat intake, as well as increased dietary fiber intake. I always like to say to any room, and we just saw a plug for fiber in the last presentation, which I appreciated so much, and I shared it on social media. Fiber is my favorite thing to talk about, and my main message. If you can tell your clients one thing, it's that they should meet their targets for fiber. If they can increase their fiber intake, they will automatically be increasing their plant intake, because fiber only comes from plants. And if they're meeting that target of at least 30 grams a day for fiber, even more, then they will be eating quite a lot of plants. So that's wonderful. And fiber, we have a lot of evidence for it decreasing our obesity risk, cardiovascular risk, cancer risk, diabetes risk. So that's just a plug for fiber and a reminder to all of us to encourage fiber intake. And regular physical activity. So those are a few things we can keep in mind that we can be encouraging our clients towards. I would encourage you to think of weight loss as a secondary outcome, not the primary goal of your treatment with someone. So what could be some of the primary goals that we could be focusing on? Improved diet quality, and I'm talking about that long-term lifestyle change. So not just eating healthier for 3 weeks, but eating healthier most of the time for the rest of your life. Also improving a relationship with food. How many of us see clients who struggle with their relationship with food, have a maybe abusive relationship with food and their own bodies? I can tell you as a dietitian that this is something I see every day with my clients, and so that absolutely can be an outcome to focus on. Improved fitness and energy, improved lab results. So if we have people, say, with high triglycerides or high cholesterol, we're going to decrease those to improve their general health. Improved comprehensive anthropometrics. So you might or you might not use anthropometrics as part of your counseling, but I would encourage you, if you are using anthropometrics, please don't only use BMI. BMI is a tool that was really developed for research rather than necessarily individual one-on-one counseling. I would encourage you to also think about waist to hip ratio or waist circumference as easy anthropometric measures that you can take in a clinical setting that are actually better individual predictors of risk than BMI is. And possible reduction in the reliance of medications. So we heard wonderfully from Dr. McDougall this morning about inspiring stories of people being able to reduce their reliance on medications. That's another potential outcome that you could be striving towards with some of your clients where appropriate. So I will say that as you strive towards some of these goals, weight loss is a likely, not always, but a likely secondary outcome that will come as a result of moving towards these goals, which are a better measure of overall health rather than simply looking only at the number on the scale. And I just want to emphasize, speaking as a vegan dietitian, that what does not work is shaming people. So I really take a stand there in my personal practice and also in my social media that I'm very careful to not allow fat shaming as part of my practice or in my social media space. I want everyone to feel welcome and safe in that space. And so I think that it's not motivating to call people out and shame them regarding their body size. That's not to say that I'm celebrating fatness as a goal, I do support people every day with helping them to achieve weight loss as part of an overall package of improving their health. But I don't think that and sometimes we as a plant-based community can be a bit guilty of fat shaming. So I'm calling us all out here to just examine our own practice and our own way of speaking with our clients and being in the world to just remove shame from the vocabulary. So let's look at behavior change in context. This is infant mortality rates in the US between 1960 and 2011. So we see a big drop in infant mortality rates. Now, if we were to go back to like 1900 or something, we would see even bigger drops in infant mortality. And these big sweeping changes don't necessarily come primarily as a result of individual behavior change counseling, working one-on-one with families or with mothers to encourage healthy endeavors like breastfeeding and those kinds of things. Of course, that is part of the package. But let's think about what else is part of the package. Education for women, child spacing, having fewer children, better sanitation, better housing, all of these vaccinations, of course, all of these things, much of which are actually occurring at a public health level or a community health level, are also important in terms of behavior change. It's about creating an environment where being healthier is easier. So I want us to recognize that it's not all on the individual, it's also about creating healthy environments. And remembering the social determinants of health. When you're working as an individual clinician, there might not actually be in a one-on-one appointment all that much that you can do about your patients or your clients' social determinants of health, their education level, their economic stability, that kind of thing. You might not be able to do that much about it, but I want us to just take a moment to recognize that all those factors are at play, and they do play into the ability of your client or their patient to be able to implement strategies for behavior change, and they are acting on your patient in terms of determining their health status, not only their individual behavior. So we might be able to have an influence on individual behavior, but let's remember that overall context. And this is from the Ottawa Charter for Health Promotion. It's a Canadian document. So we do have developing personal skills in there, but just to remember again this overall picture that we have of creating supportive environments, making healthy choices easier. So I want us to remember that it's not only the individual behavior change, but the community and the environment that your client is in. And we as clinicians can certainly be involved somewhat in helping to create those conditions in our communities, being motivated to do that. But in the clinical room, just remembering that this person's life is bigger and the influences on them are bigger than maybe what they can do through behavior change. So let's move to our case study. And I see a lot of this kind of client. This is the kind of, I see this person quite often coming into my counseling space. And so let's say we have a 34-year-old woman. She has a BMI of 35. She has some slightly elevated risk markers for cholesterol, triglycerides, hemoglobin A1C, but she's not on any medication yet, and she doesn't have any specific diagnosis yet. But she's concerned. She's maybe at the high end of normal for some of those numbers. She has a family history of diabetes. She reports emotional eating and anxiety, you know, maybe cookies at night before bed, and she kind of feels she can't stop and she's quite anxious about it. She has watched Game Changers. How many people have watched Game Changers? A few of us. Documentaries are so powerful, you know. I see so many people who get in touch with me and they say, I watched Forks Over Knives, and I'm excited about trying to go plant-based, and I don't know how to do it. So she's watched Game Changers, and she's interested in a plant-based diet. So just take a minute and talk to the people next to you. We're just going to take a minute and see, what else would you want to know about her? What would you ask her in terms of your nutrition assessment of her? Okay? Okay, thank you. Hopefully at your tables you have been discussing some of the other things that you might want to know. Those of you who have looked at the slides will see some of the things that I would like to know when I work with a client. So I want to take a diet history. I would usually do a 24-hour recall. You may work with food records, but we want to know something about how does this person eat? We also want to know about their weight history. Her BMI is 35 right now. What's been her weight changes in the last 5 years, let's say? Do we want to do comprehensive anthropometrics? If you're using anthropometrics as part of your clinical work, then you might want to take waist and hip measurements to do waist to hip ratio and waist circumference. Let's explore that food emotional eating behavior that she talked about a little bit more. Is this a disordered approach to eating? Do you need additional support in terms of providing services to her? Are you going to be able to manage what she's working with? Do you need a therapist to work alongside you to support her managing her eating behaviors? Does she have a history of disordered eating in her past? What about body dysmorphia? What's her body image like and her relationship to her body? What are her sleep patterns like, her activity patterns, any family history of disease? Is she taking any regular medications, supplements? Her self-reported mental health. And I would say it's very important to integrate discussion about mental health into your discussions with your clients. At the moment, I'm simply using self-reported mental health. I'm really just asking people, you know, do they have frequent days where they're feeling blue? Do they often feel that things are kind of getting overwhelming or on top of them? Do they have a lot of worries? I ask those kinds of probing questions. If anyone has a really nice tool that they use in practice to screen mental health, I would love to see that. I have looked online. I haven't found anything that I loved. I just use a self-reported, just by asking a few questions to see if there is some anxiety, depression there. And I often find that there is. A lot of my clients, when they come to me, are already taking some medication for anxiety and depression. I do find that quite often. But I also do find, even amongst those who are not, that a lot of people do have quite a bit of symptoms, anyway, of depression or anxiety. I'm not able to diagnose depression. That would be a medical doctor who would do that, but they are experiencing symptoms. So then also asking about what their type of work is, what their stress level is, and what kind of social life do they have, and what network do they have. Do they have a supportive partner at home, family members who are there to help them with any change that they're going to be making, or are they living on their own? Are they working like 14-hour days at work? Do they have, someone that they love to go to the gym with? Those kinds of things. Or do they have friends who love to go out and drink beers and eat nachos? What kind of environment are they living in? So let's talk about motivating change. Now, you've probably seen the trans-theoretical model before. We won't spend a lot of time on it because I think you're probably familiar with it, but this is just getting the idea of where is your patient at, your client at, in terms of their readiness for change when they come in. I'm lucky that most of my clients are self-referred. They search for me online. They're maybe looking for a vegan dietitian. They search vegan dietitian. They're thinking, oh, I want to make changes in my health and my diet. Or maybe they follow me on Instagram and they think, oh, I'd like to have an appointment with her. And they come to me already pretty motivated. But many of you might be working with clients who are not so motivated. Maybe they had a really serious health event and that's brought them to your door, and they don't actually maybe really want to make changes. They're not coming looking to make changes. So they may be pre-contemplation, or perhaps their diagnosis, maybe they've just been diagnosed with diabetes. Maybe that makes them very motivated because they're very interested in not having to, say, go on insulin, and they're very motivated to use lifestyle measures. So it's important to recognize where your client is at in terms of their readiness for change. It's not only about the practitioner and what we can offer, but it's a relationship that the client is working with you on making these changes. They're actually the one who is going to do most of the work when they go home, right? And so they have to be, when the rubber meets the road or whatever on Monday morning, they have to be ready to actually, go and do the shopping, to chop the broccoli, to go to the gym, or whatever you're going to develop in terms of a plan for them. They have to be actually willing to do it, because you're not going home with them to make 5-bean chili. At least probably most of you are not. And so, you have to be able to recognize where they're at and what they are actually ready to take on at this time. So this is, you might have heard of Gretchen Rubin. I'm just going to flash back to here. This is something that I think is really interesting. This book has really, the 4 tendencies has really kind of caught on, and it's a bestseller. And I would encourage you, even if you don't end up buying into Gretchen's online screening tool that she has, which I do think is quite helpful, I would encourage you to take a moment to think about what motivates my client, what works for this individual person that I'm working with right now. And even just broadly grouping them into, are they a person who is more motivated extrinsically or intrinsically? Are they a person who, once they make up their mind to do something, their integrity will be with themselves, and as long as they are on board, then they will do it? Or are they more a person who is motivated by pleasing others? And so they may have made a promise to their grandchildren, or to you as their practitioner, or to their partner, and that's what gets them out of bed in the morning to go for a run, or that's what keeps them eating the healthier food, is the fact that they've promised to someone else, and that person is expecting something of them, so they want to please and they want to maintain that integrity. So Gretchen has these 4 groups, and I would encourage you to have a look at this. The quiz is free online, and maybe just find out for yourself what you are. And maybe with some of your clients, you'd be interested in finding out, are they an upholder? So they are meeting outer expectations, an obliger, a rebel, or a questioner. The upholder says, I do what others expect of me and what I expect of myself. Okay, so an upholder is very into commitment. They'll uphold commitments they make to others and commitments they make to themselves. A questioner, this person's kind of a researcher. They will not do it unless all their questions are answered and they really feel that this is the right course of action. They are a questioner. They say, I do what I think is best according to my judgment, and if it doesn't make sense, I won't do it. So if you're telling them something about a whole food plant-based diet, and in the back of their mind they've got, but I saw something about the keto diet, and they said that it was better, so I don't know if I believe you. And if you don't satisfactorily answer their question, or if they don't feel comfortable to pose the question, they'll go home and they maybe won't implement what you talked about because they still have questions in their minds. An obliger. I do what I have to do. I don't want to let others down, but I may let myself down. They won't always honor commitments they keep to themselves, but they're more motivated in keeping others happy and honoring their commitments to others. And the rebel. I do what I want in my own way. If you try to make me do something, even if I try to make myself do something, I'm less likely to do it. As soon as someone, it's like when you're a kid, maybe your mother told you to practice the piano or go clean your room, and you might have already been thinking you might clean your room, but as soon as your mother told you to do it, you're just like, now I don't want to do it, just because you told me. If you were that kind of kid, you might be a rebel. So, but it's important to know what your client is, what your patient is, in terms of what motivates them, intrinsic or extrinsic factors, in terms of designing what kind of interventions. So let's just take a moment, let's say that woman, that in our case study, let's take a moment at our tables to talk about what if your patient was an obliger. That's someone who is motivated by pleasing others. What kind of interventions might you suggest for them, or accountability measures? Versus, what if they are a questioner? What kinds of interventions or accountability measures would you suggest in terms of helping someone transition to a plant-based diet? You've got, what would you do differently if she's an obliger versus if she's a questioner? So just spend a couple minutes at your table talking about that. Okay. I know that little break was short. Hopefully you had a few minutes to reflect and discuss at your table. Now, I would say in terms of an obliger, someone who is motivated by pleasing others, I would look for someone in that person's life, maybe that they already have now, someone that they can be accountable to, who they would be, who that person would love to be an accountability partner for that person. So maybe we're talking about them starting a new plan of going for a 30-minute walk 5 times a week. So maybe they have a friend who wants to go walking with them. How wonderful. And then they can, set up a little text string where they plan their walks and they go for walks together. Or maybe they're trying to do something and they're not able to have someone join them, but they could join. There are lots of Facebook groups, for example, where you can post after you've done your workout, hey, I did my time at the gym and this is what I did today, and other people will comment, oh, good job, and here's what I did today. And a lot of people are really motivated by that. They're motivated by having a group to report to, or maybe joining a group fitness class, that kind of thing. And maybe that person actually is in a place right now in their life where they don't have someone who's able to be that supportive, positive person. Maybe that's something you can discuss about helping them find that kind of network or person. But also, maybe you can be that person for them, and you can make like a little, tick box sheet or something and say, I would like you to fill this in, where just mark off the times that you did your walks for the 5 days, and then at the end of the week, just email it back to me so that I can see that you've done the walks. So that person is an obliger, and they want that positive feedback from you. They want at the end of the week, when they send their walk diary to you, they want you to write back, oh, that's so fantastic. You did such a good job. You actually did your 5 days this week. That's great. I look forward to seeing your log next week, you know, because they're looking for that positive feedback. That's what motivates them. Now, a questioner doesn't really need your feedback in that same way, but maybe they would be interested, and you know, we talked about the power of documentaries. They might be interested in more information about this. So you've talked to them about a whole food plant-based diet. Maybe they've never watched Forks Over Knives. So say, why don't you go and watch this documentary? I think you'd find it interesting, and note down the questions you have while you're watching the documentary and email them to me. We can talk about them in the next appointment, or I'll try, if you have the time in your practice to respond to questions by email, then that's great. Otherwise, say, you know, let's schedule an appointment for next week, and you can come in and we'll talk about the questions, and just make sure that you have all the information you need to start out on this journey. And I'm sure you all thought of a lot of interesting ways of handling these different clients as well. I also want to talk about, in terms of behavior change, there are our habits, which I'm going to say happen kind of at a surface level, what we're actually doing. And then there are the underlying drivers. And I see this most obviously probably when it comes to emotional eating with my clients. And I don't see emotional eating as necessarily a terrible thing. It's, you know, food can be comforting, and that's part of a way that we learn to comfort ourselves from our families. You know, if food was offered as a comfort when we were a child, we might turn to food for comfort, and that's kind of been vilified, but it's not the worst thing in the world to turn to food. But, you know, sometimes it can turn into something that goes too far in terms of supporting our best health. Maybe the foods that people are turning to really are not very nutrient dense, and maybe it's like a lot of Oreo cookies or brownies or and you know, ice cream night after night, and things can become a little bit out of control. And maybe it's happening too often. It's not just a once in a while treat here. We're talking not just once a month, but talking, you know, multiple times a week, 3, 4, 5 times a week. Someone is reporting that they get stressed and they turn to junk food, really. So this is where I really see these two layers in my practice very obviously. The surface level habits, so the habit is turning to junk food in response to stress, and then there's the underlying drivers for the stress. So I think we can target both of these in our counseling relationships. It is important to look at the surface level habits. We can't just dismiss habit and say that habit's not important. Actually, habit is very important. We're very driven by our habits. But also the underlying drivers, the underlying emotional needs that are there, if those things aren't cleared up, if we're working only at the surface level habits and trying to change what people do when they're stressed, but we never talk about what's stressing them out and what could be maybe done about that, we won't make progress. And we actually need to look at both levels. So this is a great book about habits. And it talks about the habit loop, the cue, the routine, and then the reward, okay? And so what the author is suggesting is not so much to try to get rid of a habit, but instead to replace a habit. Okay, so we're going to have the cue, which is, in this case, maybe coming home at the end of a stressful day and going straight to the pantry and looking for what can I snack on? Potato chips, cookies, that kind of thing. You know, that's the routine. But instead, we're going to look for how can we, so we've still had this stressful day, but what can we do to replace that routine with something else? And talking through different kinds of stress management techniques. Maybe someone might like to take up yoga, or going for a walk, or talking on the phone with a friend to try to release some of that stress. Maybe taking a shower, maybe rather than going directly home, going via the gym on the way home, you know, replacing that routine with a healthier and different routine. But also, we can look at what's the cue. The cue is the stressful day. Maybe someone really needs to make a change in the way that their work environment is. Maybe they need to learn to stand up for themselves or create better boundaries at work. Maybe they need an entirely different job. As a health professional, it's probably not your area of expertise to tell someone to get a new job, but at least letting them talk about that stress and calling that into question. Do you have too much on your plate? Are there things you could change about what is stressing you? And the author talked about keystone habits, habits that can set up a positive chain reaction. And he gave the example of better sleep. I think that's a very powerful one. If we can create conditions where people get a better sleep with a better bedtime routine, maybe not looking at screens for an hour before bed, blackout curtains, whatever it is that encourages better sleep can be a keystone habit that can start a chain reaction of you sleep better, you feel better. You wake refreshed. Now you have the energy to go for a run. Now you have the energy to be calmer with your kids. Now you have the energy to meal prep, that kind of thing. You sleep better, you feel better. So some keystone habits that I use in my practice, and I do often work with my clients on these specific items. What's their morning routine? What's their evening routine? What simple shifts can they make, even that might just take a few minutes every day in terms of their morning and evening routines to help them achieve better, healthier habits? What is their meal planning and meal prep like? What movement do they incorporate in their life, especially outside? And what are they doing to establish healthy sleep patterns? And I'd encourage you to think about these as being potential keystone habits to use with your clients. And I won't take a lot of time to talk about underlying drivers. This starts to go outside really of my bounds of practice as a dietitian. I'm not a therapist, I'm not a counselor, I'm not a psychiatrist or a psychologist, and maybe your client actually maybe needs to partner with other practitioners to help them, but I do try to at least address those issues, bring them up, and give room to talk about them in the counseling space. What are those underlying sources of stress? What are those underlying potential traumas that someone might have experienced? Someone comes to you and they have a lot of negativity around their body image or some very unhealthy eating behaviors. Where does that come from in terms of their own development? Were they teased or bullied as a child, about their bodies, that kind of thing, and maybe searching for some of those underlying drivers? And I can say in my practice that the power of happiness is so transformative. Sometimes we can spend so long with somebody really trying to get them to, eat healthier and be more active, and then something happens in their life, a change of job or a new friendship or a new partnership, or something happens or they move to a new place or something, and suddenly it's a big shift for them, and those big changes that were so hard to make before are suddenly so easy to make now. So let's remember that too, that creating the conditions, and those may not always be within our power, but talking to people about what would help them create conditions in their lives to make transitions and make healthier habits easier. So we're coming towards the end now, and I want to just talk about creating conditions in the counseling room. This is what we do have a little more control over as the therapist. So factors that influence our success, our client's readiness for change, the relationship or trust that you're able to build up with your client, how good a fit you are together, and how good you are at being empathetic with them and building that relationship, the skill of the client and the skill of the counselor, the time you have for counseling. And this is, a hard factor that some of us in here, I'm very lucky to have an hour in my initial appointment with clients and half an hour in my follow-ups. Some of you here, I'm sure, are working with very short counseling times that you have with clients. You know, doctors often only have, 10 minutes with a client, something like that. Many of you may have more time, so it's wonderful to have the gift of time to work with clients, and definitely that's an influence on what you can do. And I would encourage you, if you're a practitioner that is very time limited, that you try to refer to other health professionals to support that client through change that have the gift of having more time. So referring to a dietitian, perhaps if you're an MD, referring to a dietitian who can take your recommendations you've recommended to the client that they adopt a whole food plant-based lifestyle, but you might not have the time to fully counsel them through how to do that, but referral to a dietitian who can support the person in actually implementing that. Is the client in a supportive environment at home? That influences the success and the opportunity you have for follow-up. Are you going to only see this client once, or will they return for follow-ups to your office? We can be better listeners. That's another way that we can create a better environment in the counseling room. So paying close attention, withholding judgment, no shaming, no expressing shock when people report to you that they like to eat half a pint of ice cream before bed. This is not a time to go like this, or, oh, that's why, like this is not a time to shame. This is to withhold judgment and listen, to reflect, to ask questions and clarify, to be sure that you understand. That also shows that you have been listening. And then to summarize back to the person and to share with them what you think in response to the information they've shared with you. So I would encourage you, if you haven't ever heard of motivational interviewing before, to consider that as one technique you could integrate into your practice. And it might be something you're already using or already doing, even just intuitively. But here are some of the basic steps. First of all, expressing empathy and avoiding arguments. This is not, as the person presents to you their health story and what they eat and what they do, this is not a time to argue with them about what they're doing. This is time just to welcome that information and not express any judgment. And remember that you're working in partnership with your client. Like we said, when they go home, all the work is going to be done by them. So remembering that anything that you are prescribing, you are really needing to have them agree to. They have to agree to it, otherwise it's not really going to work. Develop discrepancies. You have to call them out. Now this needs to be done within that respectful place, but you do need to call out places in their eating or in their activity or in their sleep or in their stress that you feel are leading to these unhealthy patterns in their life that could lead to increased disease risk, or even that have led to disease already in their bodies. You need to call them out. You are the health professional here. You're not their best friend, so you can't just, even though you can be empathetic, you can't really just let it wash over you and have it be okay that they're eating processed food 3 times a day and they never are active. You need to be ready to gently but firmly call them out on that and let them know that that is contributing to disease risk, and that these are opportunities for change and things to talk about together where they can make progress. Roll with resistance and provide personalized feedback. They may resist. This is not the time to argue, but it is the time to give feedback and let them know, based on your personal read of the situation, what you feel about that and what you think can work for them. And then support self-efficacy. You're not looking to meet with this person every week for the rest of their life, okay? Well, that might be very good for your income, but that's not actually what we're looking for in a therapeutic relationship. We're looking for someone who is going to be able to develop these patterns and be able to implement them for their whole life and create the healthiest life for themselves possible. So you're looking for the ways that are going to best help them to implement these things and make them lifelong habits and find out what works for your client and make it measurable, okay? Like those SMART objectives that come from the business world but are also applicable in a health environment. Make sure you can measure what you're asking them to do. Not just be more active, walks 30 minutes 5 times a week. Now that's measurable. When you come back together again next time, you can ask, how many walks did you go on? How long were the walks? Rather than, were you more active? It's so soft and so easy to avoid doing. Again, this is just talking about the time we have. I think we talked about that already, just the luxury of time. And that brings us to referrals and recommendations. We don't need to work in isolation. Just a plug again for dietitians, if you are working with dietary change with your clients, I would encourage you to find a local dietitian or an online dietitian that you feel comfortable with, that you can work with, and refer a dietitian for your client to a dietitian to help them with dietary change. Encourage them to watch documentaries, other health professionals, a therapist perhaps, a naturopath, community groups. Do they need some support in the community that you're aware of? Is there a community kitchen in your area perhaps that would be useful? Yoga, meditation, maybe they could download a meditation app, fitness classes. Maybe they actually need some practical help, like house cleaning services. Maybe they're spending so much time on those things that even if they just had someone come and like help do their laundry, they'd have more time to meal prep. Or maybe they need a meal prep service. And I find a number of my clients that are working very long hours and are making, a good income. It's not applicable for everyone, but sometimes just outsourcing that meal prep to a meal prep service actually ends up working better for them, and they get the food delivered already kind of chopped and ready, and they just need to very quickly pull it together. It takes maybe 15 minutes and it's ready to serve. That's not appropriate for everyone, but for some. Maybe a cookbook would be a good recommendation for someone if they're just looking for recipes, or following a good Instagram or Facebook site that would help give them inspiration for meals, like plant-based doctors or dietitians on social media. We will just very quickly talk about social media. I know our time is pretty much up, but just to share some of what I've learned on social media, what has been helpful for me in my practice and what I find works. So in terms, I've just shared a couple of pictures here. One of them is a picture of an article that I shared on Facebook. This isn't an article I wrote myself, but it's an article I shared on Facebook, and it got a lot of interaction. And then this is a picture I shared on Instagram. I'll talk about each of these differently. Now, I'm really mostly active on only 2 social media platforms, and I would recommend to most of you that you try to pick 2 that you really like and that are working well for you, and maybe don't go beyond 2 because it can be very time consuming. Who here is active on social media? Not just sharing pictures of your kids, but active on social media trying to promote better health choices. Quite a few of us. It's time consuming. And so maybe choose just 2 or even 1 platform that you find that you're getting good feedback and that resonates with you. I find Facebook often is a better place to post articles that involve a lot of discussion, nuance. People tend to respond more in an open up discourse. Again, on social media, do create safe boundaries. Decide what is going to be accepted. You are the moderator. Decide what is going to be accepted on your page. And if people are bullying others, then absolutely call them out or even block them if necessary. Make sure that people are safe to express opinions respectfully on your page. And don't be afraid to talk about controversial things, whether it's something that you're posting that you've written yourself or sharing things. I make it a policy that I'm very careful about the types of sites I will share information from. So be sure that what you are sharing is of a quality that is befitting for your professional designation. Just, you know, make sure that what you're sharing is actually scientifically backed, but don't be afraid of stirring up a little controversy and getting people talking. So I think Facebook can be a better place for that. And Instagram, it's all about the image. And so I do usually share food pictures, but letting people see who you are and sharing a picture of yourself sometimes is also an important thing. People want to engage with who you are and what resonates with you. You are the message to some extent, and people do want to know who you are. So if you're active on social media and you've never shown your face, be confident, get out there, post something, even a video, maybe on stories, and share your face and let people know who you are and why this lifestyle means something to you. This is a post that I had that went viral on Facebook and just demonstrates some of that thing about behavior change. Lots of us here enjoy cashews, maybe cashew-based cream sauces or cashew-based cheeses. In fact, I discovered through a bit of research that sunflower seeds make an excellent replacement for cashews in most recipes, even desserts, although it's probably better in savory applications. They're a wonderful one-to-one replacement for cashews. And amazingly, they have a much lower water footprint. They don't need to be imported. We can grow cashews right here in North America, or sorry, grow sunflower seeds right here in North America, whereas cashews, we're importing them. They are really nutritionally, both are beneficial for us. The cost of sunflower seeds, even organic sunflower seeds, is a fraction of the cost of cashews. And also, I don't know if any of you have heard, but when people when they shell cashews, the inside of the shells contains a toxic substance similar to poison ivy, and it can burn the hands of the people who do the shelling. This work is commonly done in India or in Vietnam, and it can be very damaging to the hands and the respiratory systems of the workers. So we're also avoiding that, being involved in that issue by choosing sunflower seeds instead. So kind of through all of these, people kind of got excited about this. Wow, it's cheaper. I can reduce my environmental impact. It's a nice tie-in. Vegans are often getting criticized that we don't care about people. But this is nice. We're showing that we also care about people and about the workers. And so this kind of caught on. It got more than 1,000 shares on Facebook, and I created an online downloadable recipe book with sunflower seeds as a replacement for cashews. But do go home and try this. If you have a favorite recipe that uses raw cashews, just replace them one-to-one with sunflower seeds. Soak them just like you would soak the cashews. I really encourage you to go and try it. It's going to save you a lot. But this is the kind of thing that can really catch on social media. Find something that connects with your audience and share it. And if people are getting value from it, good content, then they will also share it. So the big picture, again, just remembering that behavior change, there are many things that feed into it. It's not only our role as individual counselors, it's not only us that create the behavior change. Our clients need support from the community, healthy public health policy, thinking of the election that's going to come up, be politically active, whether it's locally or nationally. Remember when you're voting, what politicians are going to create the healthiest environment, whether that's something big, like whether you have socialized medicine or not, or something more grassroots level, like will my politician support bike lanes locally? Those kinds of questions are also important. And think of other therapies as well. Who needs to be brought into the picture here to better support my client? Do they need to also see another type of therapist as well, or am I the best practitioner to work with this person alone? Remembering the blue zones, just this broad picture of what makes a healthy environment for our clients, and getting political, voting in a way that creates an environment that is healthy and supportive. Remembering that we don't work in isolation, we work within the community and within a national perspective on helping to create environments that are healthy for our clients and ourselves. And there we go. So that's just a summary of a lot of what we've talked about. That could be kind of a final slide to remember and take away with you about how to work with our clients to create the healthiest and most holistic care plans to support them and give them the best chance of success changing their behavior when they go home. Thank you.